What is osteogenesis imperfecta? Osteogenesis imperfecta, otherwise known as OI or brittle bone disease, is where your bones break very easily with little to no cause. I started learning about OI when I was in 7th grade, merely because it interested me. Although it is not very common, it is still important to know about how this affects people and if we can see the signs in ourselves. OI is rare, but there are different types, and they might have just found a way to treat it. There are 4 types of OI, ranging from mild to severe. Type 1 is the mildest and most common type. With type 1, your body produces collagen, just not enough of it. Type 2 is the most severe type of OI. It is very life-threatening because your body either does not produce collagen or the collagen it produces is of very poor quality. According to Genetic Home Reference, the most severe forms of osteogenesis imperfecta, particularly type 2, can include an abnormally small, fragile ribcage and underdeveloped lungs. Type 3 is also very severe. If you have type 3, your body produces enough collagen for a normal person, it is just of very poor quality. Type 4 OI varies from person to person. It can be mild or severe. Being somewhat similar to type 3, it produces enough collagen, just of very poor quality. Collagen is the main structural protein found in our skin and other connective tissues. In the bone, it is a combination of calcium and collagen that makes your bone strong. When you don't have enough of the collagen in your bones, it makes them very, very brittle and break easily, which is basically what OI is. When looking at the x-rays of someone without OI, the bones look pure white. But when you look at the x-ray of someone with OI, the bones are hollow and there are random patches of white, when there are random patches of none of the white color that you would expect to see. This is an x-ray of a normal hand without OI. As you can see, the bones are very, very white. This is an x-ray of somebody with OI. As you might not be able to see because of the camera, but there are a bunch of lines, and that is from previous breaks. Because of how many lines there are, you might expect it to be from an older person, but this x-ray is of a hand of a 15-year-old girl. OI is usually passed throughout the family, but in very rare cases, it can be caused by a gene mutation. After years of doing research, they concluded that OI is caused by mutations of one of 2 genes, the COL1A1 or the COL1A2. Both genes carry the instructions producing type 1 collagen. However, in 2006, the NIH discovered that the fatal form of OI is from the gene CRTAP. The CRTAP gene codes for the cartilage-associated protein. This was found in the recessive form of OI. Of course, what you can and can't do ranges from what type of OI you have. For any type of OI, any type of physical activity could result in a serious injury very easily. In very severe cases, OI can cause hearing loss, brittle teeth, curved spine, and weak muscles. Expectant mothers with type 1 and type 4 may experience loose joints, reduced mobility, bone pain, and dental problems. More debilitating forms of OI may lead to severe complications for the mother, including the heart and lung difficulties and premature delivery. Robert Lamb, How Stuff Works. If the baby has OI, it is at a great risk of broken bones, bowed legs, and has a much higher risk of death. But with the right amount of treatment, you can lead a somewhat normal life. Of course, it's really hard for the individual going through OI, but it is also very hard for their family. Like I said earlier, a mother expecting a child who has the OI gene has to realize that life isn't going to be easy for their child. Parents who have kids with OI are often accused of child abuse, not only because their bones break easier than others, but they also bruise and get cuts way easier than others as well. People could easily misconstrue this, so it is important that they have documentation of their child's condition on hand. Of course, like most currently untreated genetic disorders, they have clinical trials going on. They currently have 29 trials to be completed, recruiting, or active in the U.S., and 51 all over the world. You can find any clinical trials at clinicaltrials.gov. They also have standard therapies which go to target specific symptoms of each individual. The treatments are aimed at strengthening the bones, muscles, and maintaining mobility. They also have hydrotherapy, physical therapy, and water that helps since moving around in the water lessens the chance of a fracture. The newest type of treatment that could be possible for OI is gene therapy. Gene therapy is where they target specific genes and altering them to help treat or stop the disease. My research has shown that when we conduct gene targeting, we can take cells from the patients and correct the gene so that they produce normal collagen, In brittle bone disease, collagen is abnormal and the bones do not function appropriately. But if we use this virus to target and correct the gene, we can generate cells that produce normal collagen, says Dr. Deely from the Mayo Clinic. The big thing about gene therapy to keep in mind is that it is still in the experimental phase, like most treatments for OI. It is also very expensive. It can be in upwards of $1 million for one treatment. They have done clinical trials, and some have been successful. OI is a very hard disease to live with. With all of the treatments that are up and coming, it might be a thing of the past. OI affects people in many ways, and with knowing more about it, it could help people with OI live a better and easier life.